41 patients from for a period of 3 years in hospital Batu where I worked. Previously, I worked in hospital Batu in Malaysia, which is near Singapore. There I was a consultant. After that only I changed to my current university. So there, this study was done there. Some patients were identified from the ward, some patients from surgical clinic, and few patients were identified from the hospital record. We arranged some questionnaires. We prepared some questionnaires. Then we can conduct the study. All of you know the colostomy. This is a yen colostomy and ileostomy, and there is a loop colostomy. It's a loop. These are two openings you can see. Here you can see the one opening. This is a basic colostomy type. Okay. Now we'll talk about the introduction. The patients with colostomy have a different quality of life when compared to others who do not have the colostomy. Okay. Some patients with colorectal carcinoma are advised to undergo colostomy, even they will be educated properly, and the care to be provided to them by the relatives in the society. So the colostomy may be the temporary or permanent. Sometimes we can perform the colostomy temporary, but for that patients no need to have a very bad quality. It's temporary only. They will bear it. Whereas permanent colostomy needs real quality of life. We have to concentrate more. We did most of the study in the colostomy. I will come back later. They embark on a journey with physical and functional impairment. Very, very important to say. You can see what is colostomy. It's not a disease at all. It's rather a change in anatomy. Actually, change in anatomy. Of course, due to disease, you may not perform colostomy. Colostomy is not a disease again. It's changing in anatomy. It's a function to allow the elimination of the bowel contents following the disease or injury. Of course, following the disease or injury, but currently not a diseased person. But the person is living very poor quality of life. That's my point. The real change is the experience of having the bowel movement from the opening made in the abdomen. That's why the bad quality of life is coming. Okay, ostomy surgery, colostomy and ileostomy are preferred frequently in the hospital Batu, and it is known as ostomy patients have psychological and social practical problems in day-to-day life, day-to-day living. Okay, studies in the Western. Our patients have different social culture. Of course, Malaysia have Malays, Indians, and Chinese people, more than Malay. So, multiracial country. So, we conduct a study in the social problems. Okay, there are general surgeons who perform ostomy and nurses who take care of the stoma. We found that there were a lot of problems faced by the colostomy patients when they were put in the new lifestyle, especially emptying the fecal matter from the body. These issues are more impaired, therefore this study was planned. What is the definition? First of all, you need to know what is the definition of quality of life. You need to know what is quality of life. Quality of life is individual perception of their position in life in the context of their culture and value system in which they live, in relation to their goals, expectations, standards, and concerns affecting the complex ways by the person's physical health, psychological state, a level of independence, social relations to salient features of the environment. This is what the international definition says quality. What is quality of life? Okay. Okay, now come to our study. What is aim and objective? The main aim of the study to explore the factors related to stress in the patients with the colostomy using the convenience sample. Okay, our aim is also to offer some solution, good solution, better to give some solution to improve the stomach care and quality of life. That's our aim. Patients and methods. This is a study was done in 2009 till March 2012. 41 patients were identified. Some patients were from the ward, some of them from the SOPD. SOPD means the clinic, surgery outpatient department, and some from the hospital records. From there, we used to call the patients, and through telephonic, only the questionnaires only they have to answer. like that I prepared this study. How the question we self-designed. There is international standard questionnaires also available, but we prepared our own designed questionnaires. And semester and the final MBBS students also involved and conducting the questionnaire. I mean the interviewing and everything. It was done through the sometime from the when we see the patient, colostomy patient coming to the clinic, immediately we catch the patient. We will conduct the interview like that. Sometime we will see in the patient in the ward, not in the fresh colostomy. Fresh colostomy patient, just now yesterday colostomy done, today there is no point in conducting the interview at all. The patient getting readmitted some other problem, maybe due to some other problem like chest infection or other causes. So the chronic colostomy only we chose, not the immediate colostomy patient will not have poor quality of life immediately, maybe later. So we selected such a patients only. Okay, colostomy, how the girls are comfortable with the colostomy. You can see the colostomy, how he is happy. Okay, this is our study. You can go through that. Okay, the colon carcinoma 21, and then the bowel injury, then the renal laparotomy sometimes is happened as 7 due to some other causes. Comorbidity, sometimes it's a diabetic and hypertension and other diseases. Sometimes we conduct the temporary colostomy, only 12. Permanent colostomy, we have 29. I'm going to talk one by one later. Anyhow, this is the total picture of the study. I'm going to talk one by one later. Okay, results. We performed the study with the 41 patients and they get some more information patient for the study due to some unavoidable reasons. Out of 41 patients, 21 patients were underwent colostomy due to carcinoma colon. Of course, the carcinoma colon we have to do a Hartmann procedure or abdominal perineal resection. They will be permanent, sometimes palliative, sometimes curative. The colostomy will be the lifelong hereafter. Carcinoma patient, sometimes to be injury bowel following peritoneal contamination. We have to do the colostomy temporarily sometime. Then fecal contamination, the peritoneum and all. 7 were due to the renal laparotomies due to various causes. And 9 were due to the causes like emergency surgeries like inflammatory bowel disease and peritonitis. Some other causes. These are the various why this patient landed into the colostomy. There were 29 permanent colostomy performed due to either Hartmann procedure or abdominal perineal resection, and 12 temporary colostomy were performed due to the temporary causes, cellulitis, perineum, sometimes fournis gangrene. To avoid the contamination, we have to divert it. To make the wound healing, we have to divert the fecal matter from so we have to perform this. Any perineal severe infection, not like a simple perineal abscess, and no need to perform colostomy diversion. Sometimes vesico-vaginal fistula also is the best treatment. Diversion is small tiny fistula, vesico-vaginal fistula will relieve it. I used to do it. Like that, there were 27 sigmoid colostomy and 4 ileostomy. When compared to sigmoid colostomy, ileostomy is worse because the reason the ileal content will be the acidic and biliary, will erode the skin. The quality of life will be very poor in the case of ileostomy rather than colostomy. Because the content in the colostomy, only the feces. After all, the feces will contaminate the skin, will clean it. Whereas the ileum content will erode the skin. And the repeated infection, skin infection would be there. And transverse colostomy, it is a descending colostomy is okay. Of course, the colostomy patient taking selfie nowadays. Okay, these sites were chosen by the surgeon according to the disease of the site, either ascending or transverse or descending or pelvic colostomy, what type or ileostomy. According to the surgeon, according to the disease, the colostomy patient face multiple problems like pain, bleeding, skin lesions, some other problems. The pain was minimum, the early period colostomy, and later the post-operative, of course, can be managed. The pain can be managed easily, okay. 35 patients had a social problem from the society since they were unable to attend the social function. I come across some patients, their family members rejected. Once the colostomy done, maybe 1 or 2 days, okay. After that, because of the different quality of life, they rejected the person from the family. Even small birthday, small grandchildren's birthday function and all, they avoided. They keep, it's a very poor quality of life. Even the general dining section time, they will not come in time. They will have separate time for the dining session. So like that, 21 patients were neglected by the persons in the family and who may not be interested in the mingle with other family functions. And 28 patients did not have a sex. Of course, sex is very important for the life. Of course, they avoided due to the partner. By the partner, maybe they may worry about the dislodgement of the colostomy bag. And also, the patient himself or herself would think maybe partner may not be interested, like that, psychological worry. That may be the cause for the not interest, might be the cause for the avoiding the sex life. Of course, the foul smell. Some of because whenever nowadays it's a very strict airproof colostomy bags and all available nowadays. Do you know one thing, an interesting thing? Who invented the colostomy bag? Anybody, if you don't mind? Sorry to ask this question. Colostomy bag originally invented by the patient, colostomy patient. Originally it was very first the colostomy was, after surgery the colostomy was done, then there was something plastic bag like that. Then after that the hanging like that, the deflation and emptying and everything comfortably. Nowadays you see, originally invented by patient because he is the person who knows all the problems. So nowadays airproof colostomy bags are all available. So of course some hospitals, because repeated you reusing the bag and all, there would not be airproofs. There would be a foul smelling in the family and all. Some grandchildren I remember very well. Used to call the grandfather, the patient, don't change the bag now. When I go to the school, you change the bag. Currently, don't do it anything. Because the house full of bad smell like that. So, this is very poor quality of life. Some patients have an intention to have a suicide also. We have done good counseling and all, it is coming later. So, such extreme it will go. Such extreme, colostomy will go to such extreme level. Okay, our study observed the frequency of the changes of the bag among them. Sometimes they change in once in 2 days, 5 patients, or 4 patients once in 3 days. This is the study how the questionnaires they answered. Some more than a week. Of course, the family condition, the finance condition, they will not have a disposable bag. They have to use the same bag and they have to rewash and reuse it like that. Then we ask them the quality of life. Number 1, acceptable, slightly acceptable. Then 3 is not acceptable. 4, very poor quality of life. Then after that, the 32 patients said 4. 32 patients said 4. 3 patients as 3. 2 patients said 2. The 4th patient said as 1. Of course, the lucky person. Okay. Sometimes the model colostomy. Okay. These are all the pictures I got in the Google. The colostomy. Okay, now we'll come to the discussion. The quality of life is very important problem for the patient with colostomy since they underwent surgery which made them to travel in the society with a new quality of life. Okay, there's a study, the Montreux study is a study that was conducted to validate the Stoma Care Quality of Life Index instrument. Denny et al. And used to open-ended interviews to evaluate how well nursing care met the needs of patients undergoing ostomy surgery. Patients perceived that the physical but not the psychological needs had been met. However, Godwin et al. Showed that the enterostomy therapist often believed they delivered the best possible ostomy care within the given time and financial. Okay. In our study, since there is no enterostomy therapist available in hospital, Patubakhat is periphery hospital. Of course, the specialist and all there is not a Batuga is a second town in Johor state. So is Johor is a big hospital, main hospital. So ours is the next one. Not the we have all specialists, but unfortunately we didn't have the. Currently they have after our conducted study and we discussed with the Pangara. Pangara means the director of the hospital and all. Currently they appointed the introstomy nurses and all therapists, introstomy therapists. That time when we conducted, they didn't. The surgeon, medical officer and the staff nurse used to give the proper advice to the colostomy patient during the ward rounds and the clinic when they come for a review. Similarly, the patient faced number of physical and the social problems because of the stoma, ranging from the work-related problems to the sports, sexual activity and the activities daily living like praying, wearing the clothes, etc. However, the patients are able to cope the problems because of the excellent family and friends. Support me, okay. This other study revealed that the colostomy patient with other diseases show the significant difference from those without other disease in their adaptation to their daily living. Another research has revealed the main psychological concern of the ostomy patient and the routine aspect of the ostomy nursing care are oriented towards their prevention. These strategies include pre-operative education and counseling, assessment of the risk for the psychological problems, promotions of the stoma self-care, assessing the satisfaction with the information monitoring. Psychological symptoms of the outpatient appointments informing the colleague and others a risk of psychological problems. In one study, 60% of ostomy reported feeling less attractive during the first year after the surgery. Other researchers found that 25% of the ostomy were depressed or anxious 10 weeks after the surgery, with the 6% suffering from the severe depression. Results. Now we will come to the results. Following this study, we identified that most of the patients were depressed and stressed. They were also found to be isolated in the family and facing multiple problems, the social problems. Some patients avoided certain type of food since the smell of the colostomy bag and most of the social problems. This study also identified some family members and some people in the community who were also later counseled regarding the responsibility of the giving care to the colostomy patient. Suggestions for the improvement of the quality of stoma patients. All the patients who are electively postoperative, we have to counsel it properly. When you plan for elective surgery, you have to counsel the patient, you may have colostomy. Suddenly, you should not plan yourself in the OT, then you do surgery, you come out, okay, I perform the colostomy, go out. Strong attitude. If it is emergency, acceptable. Elective, you have to counsel, you have to be ready. Hereafter, your lifestyle will be like that, this is the disease, this is the thing. Everything you have to counsel it. Then only you are legally, you are allowed to do the colostomy. Emergency surgery, it is exempted. Elective cases, you have to. So counseling is very important. You have to, there should be a counselors as well. Our surgeons, we may not have time. Nurses, we not have time. Separate counselors available nowadays. Find them, for them. We have to, of course, we have to create a colostomy club. As I told you, the patient himself or herself, I don't know who's the patient, identify and the new creation of the colostomy bag. Like that, they should have a club. What food you are having? Okay, avoid the eggs. Or better to avoid the fish, fowls. Like that, they are creating so many things. Discussion, let them play. You can create a club. They let them play. Let them have some fun. Like that, we used to have some entertainment. And not only the counseling, very, very important counseling, not only for the patient, but also very, very important for the family members. That's very important. If you, whatever you counseling you are given to the patient after going back the patient will go back and join with the family members, again everything will be waste. Simultaneously, we have to counsel the family members as well. There should be an entertainment, sometime competition like singing, dancing and all among themselves to make them and the family members comfortable. Mixing. Only the colostomy patient alone should not dance, should not entertain. colostomy patient with the normal persons also should dance, perform activities. Then only they have the self-confidence. This is very, very important for the quality of life. Hospital pathways experiencing more number of colostomy and adequate volume to enhance the quality of treatment. More number of ET nurses have to apply. We already, as I told you, we informed the superior management. They to appoint the ET nurses and attend the colostomy courses. And of course, the nurses and whoever in charge of the colostomy, they have to go for seminars and different higher level hospital, different there will be a seminar and workshop would be there. They have to attend. Then only they will update regarding our colostomy. Of course, employment we have to thank for this Pangara Hospital director. Pangara means the director of the hospital. The study identified some good solution which will help other new colostomy patients to improve their quality of life and minimize their mental stress and social problems. Thanks for the Google image. What the pictures all shown in the Google image. This is my references. Okay, thank you.
Thank you so much, Dr. Thamilselvam, who's General Laparoscopic Surgeon at University of Penang in Malaysia. Thank you so much. Any questions? Yes, Chair.
What is the incidence? Yeah, if it is a dressing, you mean the dressing cloth? Okay. So of course we have to after the colostomy we have to cover it properly. We have to, everything to be counseled. Not only the colostomy, the social problem. Of course the clothing, everything we have to counsel it. Of course, we have to give the proper advice to the dressing sense also. Very good. Sometimes we can see some patient. I have one of my friend, and he's a urologist surgeon. He underwent colostomy. He's my classmate, in fact. He's a disease. After that, he went dress and all covered properly. Nobody can say he's a colostomy patient. He will come regularly and do the surgery like that. Dressing also very important. I understand. What's the surgery over? Our surgery. Yeah, correct. That's what I said. Once the surgery over, the cancer treatment, whatever it is, radiotherapy, oncology, everything finished, then we refer the patient to psychiatry department. Okay. Okay. Oh, you mean to say apart from? Of course. All the multiple problems. As I told you, the multiple problem the patient will face. According to that, we refer anesthetics, pain clinic, and other psychological problem. Of course, the chest clinic, medical problem. Yeah, definitely. Thank you for the good question. So we don't keep the patient with our own department. Once the surgery done, the colostomy done, we have to refer the patient multidisciplinary activity as well. Good, thank you.
Yeah. Thank you, Dr. Thamil. Very nice presentation. For elaboration on the big problem, for patients with colostomy, elaboration of quality of life of the patients. The good surgeon who take care of the quality of life and take care about the psychological aspect of the patients. We know how much is the problem is difficult when you face a patient like you need colostomy. You know how much it's difficult to take decisions. Doing colostomy is a very tough decision for the patient to take, but sometimes you have to do it. I know how, and just to tell you how much is difficult, we have seen many patients refusing surgery because you want to do colostomy for them, ileostomy, colostomy. I have seen one patient, like 80 years old, he need abdominal perineal section for colorectal cancer, but he refused completely the idea of putting colostomy. As you said, they need very too much, psychological support. The other point I want to say is that in any major surgery, I have example like in Saudi Arabia in King Faisal Hospital, which is tertiary center for cancer, with a lot of cases of colorectal cases. So they have a specialized unit they call colostomy care, with 3 or 4 senior nurses, very expert in colostomy care. So just to tell you how the problem is really very important. And I think any major hospital should have like this colostomy unit. Thank you very much.
Thank you for sharing.
Thank you for this presentation. My question is, it was easier, I guess, for patients who had temporary colostomies as like diverting ileostomy or whatever after abdominal or anterior resection. But when it comes to like end colostomies or patients who are going to have like permanent colostomies, was like just counselors working with the colostomy care nurse and interacting with patients in the society, was that only enough just to convince patients to have this type of surgeries and having like permanent colostomy later? How much difficult was that?
You mean the temporary colostomy?
The temporary colostomy, it's okay. You will
temporary colostomy, the psychological is a very minimal. No, there is no, because the patient himself has to know it is only temporary. There is a psychological won't be much. It's only temporary. Maybe after 1 month, after one year or 6 months, definitely they are going to reverse it. So the patient will not have much of psychological stress. Whereas permanent colostomy will lot lifelong. Some patients, as I told you, some patients have suicidal tendency also in the permanent colostomy. So the mental stress in the temporary colostomy less, permanent colostomy a lot.
So counseling and reassuring the patient has to be long life.
Yeah, exactly. Thank you for sharing.
Thank you, Dr. Thamilselvam, for a beautiful presentation. Previous doctors asked already about counseling and caring by the stoma nurses, which exist in our setups as well. How do you counsel the emergency patients who are coming for possible colostomy in the emergency scenario? Do you counsel them with the perspective of mandatory or option of getting colostomy after that?
Sorry, I'm not adding.
How do you counsel emergency patients who are going
So the counseling for the emergency surgery patient very difficult, preoperatively very difficult. We cannot predict anything. What we are doing, intestinal obstruction, maybe cancer, maybe stricture, maybe TB, whatever it is, maybe the cause. So we have to counsel. Possibly you may need to undergo colostomy. Possibly we have to. In emergency, it is more safe. Possibly you may need to undergo. If it is a simple tumor and all, I take it, I'll do the end-to-end anastomosis will come out. If there is anything problem, if there is a malignancy happen, we don't emergency we don't have enough time to investigate properly. So definitely we have to land in one of the side. We don't know where we are going to land. Such a case very difficult to predict. In an emergency case, we used to advise the patient, possibly you may need colostomy. Possibly. That's all we can say.
Thank you.
Thank you.
Thank you so much, Dr. Thamilselvam.
Thank you.